Hey there, Sono Peeps. How's it going? We're going to go over a transcranial Doppler. This is a normal study. I just wanted to show you how I do it. I've done videos where I'm scanning myself before. This one's just going to be pretty much the protocol I do. So I normally begin in the neck, in the ICAs. For these exams, I typically use the sector probe at a very low frequency, 1 to 2 megahertz, and a 9L linear probe for the carotids and for the ophthalmic arteries. So I begin in the right internal carotid artery. You can see it right here. Take a grayscale image, a color Doppler image, and then one with spectral flow. I turn on the envelope to do the, we want peak systolic, end diastolic, and time averaged mean. So I turn on the envelope for that. Then transverse grayscale, color Doppler. There you can see the bifurcation, ICA, ECA. And then we do the left side. So grayscale, color Doppler, and a spectral Doppler. Same thing here. You can see there's a little bit of reversal of this envelope. There's a trace sensitivity knob on the machine that you can go up on that as well to try to get a clearer envelope on that. Then transverse grayscale, you see both vessels there, ICA, ECA, ICA, ECA with color, and then we're done. So now I go transtemporally right here, pretty much right anterior to the ear at the temple, transverse with the notch of the sector probe facing the patient's anterior. So this is the patient's anterior, posterior, right side, left side. And you can see, so I like to take a grayscale image of just the cerebral structures. Now at 2 to 3 megahertz, I'm at 3.6 megahertz. You're not going to get much resolution of cerebral structures, but it's nice to just take a grayscale image. If there was a mass or something like there, you would be able to see if there's potentially a midline shift, because you can see the interhemispheric fissure here, thalamus around there, and then I add the color Doppler, and then you can see the circle of Willis. So here you got your MCA, middle cerebral artery, left middle cerebral artery, because this is right, this is the left, anterior, and then the beginnings of the posterior cerebral arteries. So I take color Doppler images with regular color, adjusting the scale as I go, and the frequency. Here you see the color frequency is at 1.9. I put the scale up because I don't want any flashing artifacts. I like to use the regular color Doppler because if there's maybe a stenosis in one of the arteries, you'll see aliasing. Once I, review the arteries with the regular color Doppler, I'll put on the power Doppler just to get better fill of all the arteries. So again, circle of Willis, and then middle cerebral artery. So now I'll begin interrogating the cerebral arteries, beginning with the middle cerebral artery on the right side. Remember, this is the patient's right, anterior, posterior. So all this here is the middle cerebral artery. I go from more distal or more peripheral to more medial. So begin out here. I'll take a sample here, about one here, and then one here. All right, so first sample there. You got a nice clean envelope, and the peak systolic is 124, which is normal, and the time average mean is 92. Now, in this case, we're doing it for sickle cell anemia, but you could also do these for vasospasms, and they have different parameters, which I'll show you at the end, but this is normal. Took another sample there. Peak systolic at 140 or 140.9, and then time average at 96, about normal. And you see it's got a nice low resistance monophasic waveform. There's no reversal of flow. Then the middle section, 102 peak systolic, 79 time average mean. Time average mean on the GE machines is TAMAX, or time averaged mean. Other machines will be mean flow velocity. They'll have different terminologies, but it's for the same type of measurement. So more medially towards the midline. Here you see the MCA here starts to go into anterior cerebral artery. So I usually take about there. If you go too low, you'll start to get a lot of reversal flow because you're getting both MCA and ACA. So keep the gate size small, not too small. You want it big enough to cover the vessel, but not too big where it gets both, because that's what I do after this. And here's another one, MCA. So I usually do 3 or 4. In this case, I did like 5. Just interrogate it along, make sure there's no focal area of increased velocity, which could be due to stenosis. So once I'm done with the MCA, I'll do the ACA and MCA together. So the middle cerebral artery and the anterior cerebral artery together. I'll open up the gate so I can pick up the flows for both vessels. And you're going to have one going above baseline and one going below baseline. So the middle cerebral artery is going towards the transducer, and the anterior cerebral artery is going away from the transducer. So above baseline is going to be MCA, below baseline is going to be anterior cerebral artery. So I take that image, don't measure anything. I'm going to make my gate size smaller, my sample size smaller, and then start focusing on the anterior cerebral artery. So I'll take one about there, and anterior cerebral artery is going to be below baseline. So middle cerebral artery above baseline, anterior cerebral artery below baseline. Posterior cerebral artery has two segments, which we'll get to that now. And P1, segment 1, is above baseline. P2 is below, and I'll show you why now. So anterior cerebral artery, peak systolic at 103, time average mean is 77, normal. Take one there, and then take another one. About here. So around here, both anterior cerebral arteries are going to meet, and then they go and they'll start to curve around the corpus callosum, and it'll become the pericallosal arteries. So as it goes up superiorly. So I usually just angle about here. You know, around this section, you have the anterior communicating artery, which you're not really going to be able to differentiate on color Doppler at these frequencies. So I just focus on the anterior cerebral arteries in this segment. So then go to the posterior cerebral arteries. So here's the posterior cerebral artery. It's usually in a curved shape like this, which P1, you know, segment 1 is P1 and segment 2 is P2. The reason why segment P1 is above baseline is because the blood flow is going towards the transducer, then it curves, and then it goes posteriorly, and it goes away from the transducer. So P1 is going to be above baseline, P2 is going to be below baseline. Posterior cerebral artery, P1, 99 peak systolic velocity, 79 time average mean, nice pretty waveform. See here, I've turned the color Doppler back on, so you see that the blood flow is going towards the transducer and away from the transducer. So then I Doppler segment P2, and it's going to be below baseline. So here, if you're having trouble picking up the envelope, you can increase the gain of the Doppler a little bit, but that's decent. Peak systolic of 84, time average mean is 60, normal. All right, so now I'm done with the right side. Now I'll go basilar or posterior, and the posterior fossa right here, and try to get the basilar and vertebral arteries. And that approach here, the vertebral arteries will be first, and then the basal artery. And usually it's in the shape of a Y. Now, this can be hard to get on some people. Like me personally, when I scan myself or anybody scans me, you can't get my basilar regardless of what probe you use. So keep that in mind. Some people, you might not be able to get this view. People maybe with smaller heads, younger patients, you might. So here you got the basilar artery and then the right vertebral, because it's the right side. The notch is toward the patient's right. And then this is the left vertebral. And on some patients, you get it real, very, very nice. But here you got vertebral, and basilar. So I'll do the basilar first. Now, all these blood vessels, remember, you're approaching from here. The blood flow is going from the vertebrals up into the basilar, into the circle of Willis. So it's going towards the brain. If your probe is here, the flow is going away from the transducer. So all that flow is going to be below baseline. So 98 peak systolic, time average of 75, normal. Then you got the right vertebral right here. Nice, beautiful waveform, 82 and 60. And then the left, 53 and 43. Now that might be because this one's kind of at a 0 degree angle to the probe, so you're going to get a nice clean waveform. And this one, you can see, is kind of coming at an angle. Now TCDs wouldn't use angles at all, even though we are worried about velocities and stuff like that. And usually for velocities, you're going to want to use angle correction. But the people who developed TCDs, they did it with using continuous wave Doppler machines with no angles. And those are the parameters that are used, and those are parameters that are still used. So we don't use any angles on any of the arteries. So if I were to put a angle there, this flow might be a little higher, closer to the right one. What you can do, you can also change your approach and try to get that vessel to become more parallel to the beam of the ultrasound. Boom. Done with that. Now we go to the left. Same thing. Temple right here. I usually find where the ear right here meets the temple or the skin here. I usually like go there, and then I'll angle up and down, left and right, rotate a little bit, pivot until I find the nice transverse view that I know I'm going to get the color Doppler on. Obviously, you can turn the color Doppler on and do it live until you finally get it. So again, transverse brain looks pretty good. Here you kind of see the interhemispheric fissure right here, the thalamus or midbrain, and maybe some of the posterior fossa, maybe some cerebellum. But again, you can't really make out the anatomical structures as good as you can like on a neonatal brain, but I still take this image there. Then color Doppler, so you got your nice circle of Willis, anterior cerebral artery, middle, posterior. Here you see P1 and P2, and that's the circle of Willis. All right, so now I'll put the power Doppler on. And again, I'll Doppler more peripherally, peak systolic of 88, time average of 63, and then I'll start working my way more midline. 128, 91 is good. And something you got to keep in mind, sometimes when you're doing these TCDs on patients, they're very relaxed and they might fall asleep. And when you fall asleep, your breathing patterns change, and the velocities you might start getting at the beginning of the exam might change as a patient starts to breathe either more slowly or more rapidly, depending on how they breathe when they sleep. The oxygen demands of the brain may change and may cause velocities to go up as they're sleeping, especially if the respiratory rate goes real low. So that's something to keep in mind. All right, so middle section about 137, time average of 100, normal. As I went more closer to the midline, I was getting a lot of both of the vessels. So then I just opened up the gate to get the MCA and the ACA. Again, I don't measure this section. It's just to show the both waveforms. Then close the gate back up and start with the left anterior cerebral artery. Peak systolic of 91. Time average of 64. Normal. Nice, beautiful arterial low resistance waveform. And then another segment of the ACA. 78 and 52. Normal. So now you got your posterior cerebral artery. You can see this nice curved shape that it has. P1, P2. P1 is above baseline, P2 is below baseline. Nice clear waveform, 76, time average of 51, it's normal. And then segment P2, 81 and 59, just beautiful. So once you're done with that, now you're gonna go into the ophthalmic arteries, and that you're pretty much done. So I take a grayscale image of the eye. Here you can see the globe of the eye. This is the vitreous humor, and you can see the optic nerve right here. And then take a grayscale image, a color Doppler image showing the blood flow of the ophthalmic artery, and then a spectral tracing. Now here you can see you got the nice arterial waveform, but you also got some venous flow. So if you put the envelope to trace the time average mean on this, it's going to be going all crazy because it's trying to pick up flow from both sides. So in this case, if that's the case, I just trace it myself. So when you hit the measurement button on the GE, if you hit, there's 4 clicker buttons. If you hit the top one, it'll change it from measurement to just measure centimeters to trace. So once you do that, you can just trace the actual waveform and it'll give you the same parameters. Vmax would be peak systolic velocity and time average mean is 7. You want to be around this area too. If you go too deep or too posterior, you'll get the siphon, which is the part where you got the ICA and then the ophthalmic artery comes off of the ICA. You don't want to get that. The velocity is going to be higher, and that's, you're not in the correct artery. So this is the ophthalmic artery is where you want to be, closer to the globe. And here you can see the lens of the eye. I did a pretty long video on ocular ultrasound. If you guys want, I can post it in the comments or whatever. It's pretty in depth if you're interested in ocular or ophthalmic ultrasound. All right, and then the left eye here again, you can see the lens, grayscale, color Doppler. That's the ophthalmic artery, and then spectral waveform. Same thing. I'm tracing it, and I'm getting a peak systolic of 11 and a time average mean of 6. And that's the entire exam. So on my website, I have an article on transcranial Dopplers, and I have several videos on YouTube as well. The article is a good primer if you're starting to learn TCDs. I go over the anatomy. You got your circle of Willis, middle cerebrals, anterior communicating, posterior cerebrals, the vertebrals, the basilar. All right, indications. In most cases, it's going to be for sickle cell disease or for people that have subarachnoid hemorrhages or any type of hemorrhagic stroke to rule out vasospasm. All right, some more anatomy of the aortic arch in all the branches. Inanimate, left carotid, left subclavian. A diagram on my neck showing all the blood vessels, the same as that one. A diagram of the ICA and its segments. So you got the cervical segment, the petrous segment that goes to the petrous bone, the cavernous segment, and then the cerebral segment. And then right here comes the ophthalmic artery. A nice little animation of the cerebrovascular arteries. OG, Thomas Willis, who the circle of Willis is named after. Here's a power Doppler of the circle of Willis. Another diagram. So lots of anatomy. Then I go over all the different vessels and the segments and how much of the ICA fluid receives. So it's a pretty in-depth article. This is pretty much all the vessels you're interrogating: anterior cerebral, middle cerebral, and posterior cerebral, P1, P2. And then the ophthalmic arteries. And here's another view of the basilar with it's like a Y shape. So vertebral, and then basilar. And here's your approach through the back. And then the orbital approach, which is the ophthalmic artery. So here are the normal values for adults. Screenshot that if you want, or you could just go visit the website and you could take that. This is from the radiographics article. And then for pediatrics. And this is by age. These are like means. And then you got the criteria. So anything less than 170 peak systolic velocity for time average mean. Anything less than 170 is normal. And for peak systolic velocity, anything less than 200 centimeters per second is normal. And as you see in that exam, all those values were below these parameters, so it was normal. Right? And then I have a couple cases of, vasospasm and stuff like that. So yeah, check it out. Remember, sonographic tendencies. I hope you guys enjoyed this video. I've done a few TCD videos. I don't get to do as much TCDs as I used to. They're fun to do, and it's a good skill, another exam to have under your belt. All right, take care. Bye.